Good afternoon, everyone. Welcome to the Joint Information Center briefing for Wednesday, February 10th, 2021. Next slide, please. Administrative notes. Next slide. Enter Unified Command Team. Next slide. Our additional speakers today. Next slide. Lines of effort and priorities for the Joint Operations Center. Next slide, please. Purpose of JIC, Joint Information Center. And our agenda. Okay, leading us off today, as he always does, from the Public Health Department, Eric Pessel. Eric, go right ahead.
Thank you, Dirk, and good afternoon, everybody. Update of our current numbers, our situation in Calhoun County, we're at 8,037 confirmed COVID, laboratory confirmed COVID cases. Our total hospitalizations to date are 385, and our deaths are at 209. As you can see on our graph, while we're trending down, we are still much higher than we were back in July, August, and even entering into September. So, as a theme that we're going to hear again today is that we really need to continue to do the things that we've talked about for the past year. Wear a mask, stay socially distant, try to avoid indoor gatherings, large indoor gatherings, things of that nature. Next slide. A little bit of vaccine update here for the Public Health Department. Our numbers as of this morning, we have now administered over 8,000 doses of vaccine just at the Public Health Department. And I believe that the total county numbers, which is off of the state's dashboard, is now over 17,000 doses have been received by specifically Calhoun County residents. That's, it's getting there. I figured if we're going to continue with the 2-dose regimen, we're looking at a need for about 200,000 doses in our Calhoun County residents. If we want to do 70%, and of course 2 doses. So, 17,000 is a nice number, but our goal by the end of the year would be to reach 200,000. Also, I want to just point out that we were here this week, hopefully next week and the week following, we received not only Pfizer vaccine from the state, but we also received a small shipment of Moderna. And due to various complicating factors, we really, as a public health agency, we don't want to do both types of clinics ourselves for various reasons. And I want to really thank Oaklawn Hospital for stepping up and partnering with us to actually run the 400 doses that we received this week. They're running a senior clinic working off of our wait list in Calhoun County. And Carla and her group was able to schedule that, and that clinic is actually happening today. And from everything I've heard, it's going well, and they're already looking for where they're going to do it next week. So while the Public Health Department is doing a bunch of second dose clinics this week and some schools this week, so we don't have a lot of first dose on our schedule, at least we're getting some first dose done of our seniors through Oaklawn, which has been just really a good partnership. Grace Health in Bronson is also partnering with us. We meet with them, with these folks every week, and they're looking to work on our refugee population, the Burmese and our Hispanic Latinos. So, more to come on that in the future. Last slide. And a little bit, we did have a press release on Monday that talked about the B117 UK variant of the COVID was found in Calhoun County. I believe now there's 10 or 11 counties that this variant has been found in. think it says in the slide there's been 23 positives of the variant in Washtenaw. We had 4 here in Calhoun. Kalamazoo now has 4, 8 in Wayne County, and then the rest I think are all just 1 each. But the message is clear for this variant. What we know is it appears that it's more transmissible. What that means is it's easier to pass from one person to the next. So why is that a concern for us? Well, it's a concern because if it's easier, then we could end up with higher numbers. Higher numbers lead to higher hospitalizations. Higher hospitalizations lead to higher deaths. So like I said in the first slide, and I'm going to say it again, these protective actions are what we need to do, and we need to do this for the foreseeable future. I know we're getting tired of it. We've been talking about this forever. It's just going to have to become a way of life for now, that we need to wear a mask. We need to stay 6 feet apart from people. We need to wash our hands often, ventilate indoor, avoid gathering indoors in large groups. And if we do that and we get vaccinated when it's our turn, sometime late summer, fall, maybe we can get back to something that's a little more normal. So that's my update, Dirk, and thank you very much.
Oh, thank you, Eric, very much. Next on the agenda to discuss Protect Michigan Commission is going to be Carla Fales, the CareWell Services CEO. Carla, go right ahead.
Hello there. Yes, just a couple of things from both local efforts. So we are developing strategies working with the local and state to reach out into our homebound population. We've had a couple meetings at the state level about how to do this, because we know for some people it's just not practical to have them come out to a vaccine clinic. We've done really well with the folks that we've had to provide some accommodation for, but that's just really tough for our homebound, which can include our Meals on Wheels recipients, our waiver participants, PACE participants, and then also just people in the community. So folks can still call the hotline, the 441-0912, to get on the wait list. We took almost 2,100 people off the wait list this week. And some of that's from, as Eric has mentioned, the multiple clinics that are going on. We're able to move through that list and get folks signed up. I am at the clinic at Oaklawn Life Improvement Center today, and yes, it's going very well. And part of our messaging is just letting folks know that, if they're on the wait list, they should have received a recorded message. We sent out a big one last night. Is just be patient. It is going to take some time. We know that this is not a couple week effort, that is a multiple week and month effort. And we're still taking names. And if there are individuals who are homebound, who feel that it's not possible for them to come to a clinic, we will put them on the wait list, and we will mark the fact that they are homebound and need to be added to that list. We did get approval from the state to do our homebound. We're just waiting on some protocols related to how the vaccine can be transported, or if it can be transported, and things like that. Next slide, please. So the Protect Michigan Commission is created by the governor, and it includes people from all over the state. Battle Creek Mayor Mark Menke and myself were appointed, and the commission shares the goals of the rest of our state and the governor in seeking to get to a 70% vaccination rate for all Michiganders as quickly as possible. And so that's why all of these efforts around the schools and our senior population, our direct care workers, are so important, and why we need to keep, as Eric said, wait our turn and get the vaccine when it's time. They also want to ensure that 90% of the doses are being used within the 7 days of arrival. I can tell you Calhoun County is doing an exceptional job on this. Haven't had any issues, and even strategies like running additional clinics when there's 2 different types of vaccine is just a really effective way to reach that goal and make sure that we're not wasting any doses. And then also ensuring that our 95% of the people who got the first dose get the second dose within the expected time frame. And we have been working with folks to make sure that we schedule them when they are going to be here for both vaccines, or if they're going to be coming back into Michigan, then we know when they're going to be here on the wait list, and we can schedule them that way. And of course, we don't want anyone to have to drive more than 20 minutes to get a vaccine. What we've seen of our seniors is they will go anywhere if it means getting vaccinated, which we like that. But so the strategy that has included some of our smaller clinics like Teconcha and Albion. I know we're working on some other rural clinics, Marshall and Battle Creek. That really speaks to that goal of making sure that folks can get to the vaccine. And then, of course, we want to have equitable access to the vaccine. So there's a number of partnerships that are occurring within Calhoun County that really speaks to this goal, including with the NAACP, with BOSAs. Eric mentioned also the Burma Center and the Burmese community, as well as others. And then, of course, having our communications that are transparent, accurate, and frequent, which is where we really need some help. Particularly when it comes to the wait list. Folks just need to know that we recorded when people called, and the list is organized in such a way that it's in the order that people called. We had 3,600 calls in the first 2 days, but we were able to get people in there in the order that they called. Information is being put out on not only the health department site, but our site as well as others. And we have had, some misinformation. And part of it's because there's so many clinics available, which is awesome, that sometimes people get confused about which clinic people got into. So we're always willing to answer questions. If people need to be taken off of the wait list, they can call the 441-0976. We've been cleaning that up as we go, and the faster we clean that up, the faster we can get through to the next people. So you can see the efforts here in Calhoun County are really speaking to the outcomes that are desired. And as a member of the Protect Michigan Commission, I'm always excited to brag on the amazing work that's being done in Calhoun County and the coordination that is happening. And hopefully will be an example to some other communities on how we have collaborated. And I don't know if there's another slide. I can't remember.
Nope, I think that's it,
Oh,
Carla.
thank you.
Carla Fales, thank you very much for your presentation. We appreciate it. Coming up next to discuss local vaccine information, Battle Creek City Manager, Rebecca Fleury. Rebecca.
Thanks, Dirk. I appreciate that. Carla is a very hard act to follow. She and her team are doing such an amazing job, and really excited to have her represent us at the state level as well. I'm going to talk about just a little bit about our local vaccine Q&A. We do have lots of stars in Calhoun County, but our health officer, Eric Pessel, and our medical director, Dr. William Nettleton, have done a really good program around the vaccine. You can find the video at YouTube, and there's a link in this particular presentation. And then there's also a snippet as far as, is the vaccine safe? And there's a short video there as well. There's so many good resources about the vaccine and experiences from both medical directors, the health department, and individuals. So please go out to the Calhoun County website, calhouncountymi.gov/COVID vaccine, to get all of the local information. I also had the privilege of being part of the NAACP event last night. I see Representative Hadsma and Senator Bison were also there last night. Really good information. Dr. Nettleton did an excellent job. Dr. Bill Manns from Bronson Healthcare and a representative from Pfizer were all on the call answering questions, particularly around our Black and Brown communities, and making sure, as Carla said, that we're making it equitable in how we distribute vaccine, and making sure we get all of the information out there to educate around the vaccine. So we have wonderful resources in Calhoun County. I agree with Carla that we should be lifted up as a shining example for everything that's being done with COVID, particularly around the vaccination. So kudos to Eric and his team and Carla and everybody involved. Thank you. I'm all set, Dirk.
Okay, Rebecca Fleury, thank you so much for that report. Moving on to relevant current reopening guidance. To discuss that, here is Calhoun County Administrator Kelly Scott. Kelly, go right ahead.
Thank you, Dirk. And I would just start by echoing the remarks of the speakers earlier who have all said that, Calhoun County, and with the resources that we have to work with, I think is doing a wonderful job being coordinated in the vaccine effort. It is an exciting time where we are looking forward to when most of us can be vaccinated by the end of this year. We're looking forward to full reopening of our businesses, of our schools, of our economies. And Of course, my day job, I'm looking forward to full reopening of county government. And so as an employer, I thought it's a good time to just bring back to the forefront what we need to be tracking as far as the rules that are still in place that essentially have put us in a holding pattern as far as our operations to the public since last July. And so taken together, the most relevant guidance that I'm tracking to be able to move to the next step in county operations and local government operations are the MDHHS gatherings and face mask order that was renewed just 2 days ago on February 8th, the MIOSHA emergency rules that were put in place way back in October, but they were effective through 6 months. And then for public meetings, we're also watching the Open Meetings Act that was amended late December. And then constantly, mainly as it relates to policies about business and personal travel for our employees, we're watching the CDC travel guidelines that were recently updated, excuse me, on February 2nd. So starting with MDHHS, the latest gatherings and face mask order really hasn't changed in its recent reiterations. So the general capacity limitations for indoors, and I've been saying I don't really pay attention to the outdoor gatherings limit at this point in Michigan. So for indoors, we are still prohibited at non-residential venues to have any more than 10 persons or any more than 2 households gathered. So that order generally means as employers, we are not allowing staff meetings, group training sessions, or public board or committee meetings in person through the length of this order, which is currently set to expire on March 29. There are some exceptions, of course. These limits do not apply to if you have an employee and a customer for the purpose of receiving services. I'll talk about the limitation that MIOSHA put in place for workplace gatherings, but there are exceptions, of course, for voting, voter and election related activities. We can still do training of our law enforcement, correctional, medical, and first responder personnel that do need to happen in a gathering setting. People can still seek medical treatment, including some services available through our health department for needed services, and of course, emergency purposes. So the vaccine clinics with all those people in one room are wonderful. So as a condition of hosting a gathering under that order, organizations, including all of us as employers, we have to design the gathering to encourage the things that Eric was talking about, maintaining physical distancing, requiring masks. And so those are rules that are still in place that require our local governments to continue to require face masks and deny entry to people who are refusing to wear face masks while gathered. A couple of items I pulled from the FAQ page on the state's website. According to MIOSHA's emergency rules, we are still under guidance through the middle of April that says work should be completed remotely unless attendance is strictly required to perform job duties. So local government offices can still be open, and we have been all along since the shutdown back last March. We are now not allowed to have public meetings or board meetings unless we have less than 10 people and from not more than 2 households. So we're essentially limited to virtual meetings according to the gatherings limit. MIOSHA emergency rules, again, that were put in place back in October for 6 months through the middle of April, essentially remind us that we're still all required to have the COVID response and preparedness plans in place. Those call for the enhanced cleaning, for us to screen our employees and contractors. We have to exclude anyone with COVID symptoms. We're still required to provide PPE and masks. We're still required to update and continue employee training and communications. We're still required to maintain proper reporting and notification when we have positive cases within our workplace. And then we also are required under the MIOSHA rules, which kind of echo what's in the MDHHS guidance. We are actually prohibiting in-person work for employees to the extent that their work can feasibly be done remotely. And again, that's through the middle of April. Open Meetings Act, of course, only applies to our public government entities that are required to follow the Open Meetings Act. That was amended on December 23rd with Senate Bill 1246, extending the authority for public bodies to conduct electronic or virtual meetings for any reason through the end of March of this year. So that law, which is Public Act 254, extends the authority for virtual meetings that previously would have expired back in December. There are also, if and when the gathering restrictions are released and we start having in-person meetings, the Open Meetings Act actually reinforces some of the protocols such as social distancing that still have to be in place for public meetings to happen. And then finally, the CDC travel guidelines, we look at, again, from the perspective of policies that relate to restricting business travel. I'm starting to see in-person conferences being scheduled for this spring. I know we're all really looking forward to getting back together with colleagues and traveling personally as well. So right now, if you look up the CDC's website, they are doing a pretty good job with keeping updates on riskier areas based on COVID cases across the United States and outside of the United States. They have updated the travel guidelines as of February 2nd, and noting they've incorporated the new rule that requires travelers coming into the United States from other countries to have a negative COVID test before they can board a flight to the United States. But then in general, the CDC is just discouraging travel. But for those of us who choose to travel anyway, their general guidance is to get tested and stay home after travel. And then, just self-quarantine for a full 7 days until you test negative, and, just, again, maintain protocol. So what that means for us as an employer is that we're just asking employees to limit their business travel unless it's absolutely essential. And for personal travel, just continue to check this website and make sure you're taking care of yourself and taking care of others. We know that there is, spread of the virus, whether you're at home, out in the community, or traveling, but we're just constantly watching all of these guidance items together and looking forward to, it looks like right now, the middle of April, several of these items are again scheduled to be revisited and or extended and or expire. So that's kind of our timeline for planning and hoping that things get better in a way that we can start to emerge safely. And that's it for me.
Okay. Kelly Scott, thank you very much for your report. Moving on to transportation expectations. And our next speaker is Mallory Avis from the City of Battle Creek. She is the Public Transit Director. Mallory, go right ahead.
Thank you. So we wanted to share an update that went into effect last week, starting February 1st. The president issued an executive order promoting COVID-19 safety in domestic and international travel that included all surface transportation, which is intercity bus, passenger rail, and public transportation like Battle Creek has. That mandate was followed up, or that executive order was followed up with a CDC mask mandate on January 29th. And then on January 31st, the TSA issued a security directive, essentially making it federal law that all passengers must wear a face mask while waiting for or riding public transportation or any mode of surface transportation. So this applies to all transportation hubs and conveyances. So if you're riding on a train, on a intercity bus like Greyhound, or on a city bus, you are required to wear a mask for the duration of the ride. We are required to deny boarding to anybody who refuses to wear a mask, and we're required to disembark any passenger who removes their mask once they're on board. So passengers have to wear their mask the entire time that they are on, or they will not be allowed on. This includes inside our facilities. So passengers have to have a mask on before entering a facility, and you have to keep your mask on while inside the facilities. That would be any train stations, bus stations, and any bus stop or shelter that has more than one person standing at it. So anywhere where individuals gather to board a conveyance, passengers must wear a face mask. The TSA security directive even goes as far as adopting what is considered an acceptable type of mask. And the CDC guidelines specifically call out things like face shields, scarves, and bandanas as being unacceptable. So a mask has to have ear loops that secure the mask securely to the face, or it can be a 2-ply gaiter that pulls up, but it must be snug to your face. So again, we'll have to deny boarding to any passengers who are wearing a bandana, scarf, or face shield. If an individual is seeking a medical exemption from this, they will need to contact Battle Creek Transit. Our contact information is 269-966-3474, and they can fill out information to seek a medical exemption from this requirement. But overall, it is a sweeping no mask, no ride policy. And that is all I have, Dirk. Thank you.
Mallory Avis, thank you very much for your report. We appreciate it. Next slide is the comments from our elected officials. And we're going to get started right away with Senator Bizon or Representative.
Hi, everyone. I'm Karen Todd, work in Senator Bizon's office. He is not able to be on the line today. He's in an appropriations meeting for corrections and judiciary this afternoon. Just wanted to give you a brief update. The governor will give her budget presentation tomorrow at 11 before the House and Senate Appropriations Committees. Senator Bizon will be in attendance. And also, as Rebecca Fleury mentioned earlier, Senator Bizon was able to attend the NAACP hosted meeting last night on COVID-19, focusing on vaccines. And it was a very informative meeting. And so he was happy to be at that. And I think it was recorded. So if anyone wants to reach out to Kerry Whitfield, I'm sure can get information from him on that. I think that's all that I have. Thank you.
Karen Todd, thank you for your report very much. Moving on to Representative Hadsma. Jim, the floor is yours.
Thank you. I have to be across the street at the Capitol in about 5 minutes. So I will tell you that what we're focused on most here in Lansing right now is ensuring that the federal COVID-19 relief dollars from late December are taken from Washington to us and then to local governments like the city of Battle Creek and Calhoun County. That's going to take collaboration between the governor's office, the Senate Majority Leader, and other Senate Majority leadership, and the House Republican leadership. And I'm confident that with negotiations that will be undertaken and that there will be significantly needed monies for families and small business, as well as local governments in the Calhoun County community. Thanks.
Thanks for your update, Jim. We appreciate it very much. Moving on to Representative Hall.
Hi, this is Matea from Representative Hall's office. Representative Hall is continuing to monitor the budget process as this proceeds. The House did approve a COVID-19 relief package last week, but of course this will need to be, proceeding through the legislative process, and Representative Hall is continuing to closely monitor that, and we invite, anyone with questions from the community to contact Representative Hall's office if they have questions about that or other issues. So thank you.
All right, Matea, thank you very much. We're going to move on to county elected officials. Okay, hearing none. Moving on to tribal elected officials. And hearing none, we'll move on to city elected officials. And moving on, township elected officials. And finally, village elected officials. Okay, hearing none, we'll move on to the next slide. Here's your best information sources. And next slide, wonderful PIO group. For the Joint Operations Center, Lucy Blair, Victor Jovanovic. Hope I got that right. Jessica Vanderkolk. I think that's all for today. Appreciate everybody attending. Wish you a healthy and safe week. Next Wednesday will be a written JIC, and we'll see you the following Wednesday. Have a great day.